Hi, I'm Marty Cohn, and welcome to episode 2 of Grace Cottage Hospital's Healthcare Matters, a monthly show on timely information about health-related topics. Grace Cottage Family Health and Hospital is an independent healthcare facility located in Townsend, Vermont, just 17 miles from Brattleboro. Grace Cottage provides traditional primary care, pediatrics, mental health counseling, 24/7 emergency care, inpatient rehabilitative care, lab and imaging services, as well as physical, occupational, and speech therapy. They also offer free counseling services with their 8-member community health team. For nearly 70 years, Grace Cottage's mission is to promote wellness, relieve suffering, and restore health. Today will be our Back to School special show. Our guests are pediatric occupational therapist Melinda Roy, who will tell us what to look for in terms of the fine and gross motor skills difficulty, and health coach Liz Harrison, who will talk about the importance of proper nutrition. Welcome, Melinda.
Thank you.
Thanks for coming on the show.
It's my pleasure.
So, when I hear occupational, I immediately think of work-related. So what does a pediatric occupational therapist do?
Well, first of all, the word occupation stems from an earlier meaning of the word, and it refers to how one spends one's time. So an occupational therapist looks at all the daily activities that a person has to do throughout his or her day. Now, with a child, we're looking at rote self-care skills. So that can include feeding, dressing, bathing at home, and then at school, we're looking at more complex, dynamic roles of being a student and a community member.
So as kids head back to school, what fine motor difficulties should a parent be on the lookout for?
Well, what we're going to be looking for is difficulty with tying shoes, difficulties with dressing, manipulating snaps, buttons, zippers, improper hand grip with utensils, self-feeding. Are they able to manipulate the utensils? Manipulating scissors and holding onto your pencil, that type of thing. Also, fine motor is beyond your hands. It can also directly relate to your mouth muscles as well, so feeding and swallowing.
Wow. So what can be done for a child with fine motor difficulties?
Well, in OT, we look at refining fine motor skills through purposeful play activities. So I have an example here.
Uh-oh. Okay.
And so we want to be able to engage kids, and we want to get on their level and make it fun activities. So this one works on bilateral hand control. So with one hand, you're going to take this little guy with the googly eyes,
Yes.
squeeze the side of his mouth to open his mouth.
Okay.
And so when you're doing that, you're working on hand strength and grip control.
Here it is. I'm squeezing his googly eyes and making his mouth work. Okay.
Now, with your other hand,
oh my goodness,
you have a pair of tweezers.
Okay.
Okay?
Yes.
So with that hand, you have to have sufficient control, isolated hand movements, and finger movements to squeeze the tweezers.
Yes.
And you're going to take some pom-poms.
Oh my goodness, this is like a test, all right?
And you're going to pick up the pom-pom with a tweezer.
Yes, pick up the pom-pom with the tweezer.
Now at the same time, you're going to squeeze his mouth open.
Okay. Oh my goodness.
There you go, and you're going to feed him.
Oh, okay.
So with that activity, like I said, we're working on bilateral hand control. We're working on grip strength with your hand holding the tennis ball. And we're looking at a refined grip of a pincer control with your forefinger and your thumb.
Wow. Okay, one more, and
Great.
get in there.
Yeah.
Okay.
So yeah, we look at all types of hand grip. We're looking at forearm and wrist stability, your shoulder girdles, wrist stability.
Okay, so that's on the fine motors. What sensory issues could interfere with school?
Well,
or home day, because some kids, not everyone goes to a school, but
Right.
they're schooled at home.
so sensory issues arise when our brains have trouble gathering and organizing all the information we're getting from our senses. So as you think about, like, you're at your desk and you're writing an email, the window may be open, you're hearing the outside, you got maybe the wind on you, maybe someone's walking by and they've got strong perfume on. All these things we can usually filter out. But kids with sensory issues have a really hard time doing that. And it can affect a variety of ways. So tactile input. Children can be overly sensitive. So clothing can be a real issue, finding things that are comfortable. Sometimes, we'll have like a little rubbing on our shoe and we can ignore that, but kids with sensory or that are oversensitive have a really hard time. So finding fabrics that kids can tolerate, bathing can be an ordeal, and even feeding due to aversion to certain food textures. That's at home, and but in the community, going out into noisy public places can be really overwhelming. And these kids, it's overwhelming to the point where it can be physically distressing.
Wow.
So in the school setting, you can transitions can be hard. So going from a quiet classroom to a jostling, busy, noisy hallway can be really distressing.
Wow. So are there any treatments for sensory issues? I mean, what do you...
Well, there isn't, a cure fix. But however, what we can do is offer what we call a sensory diet. And a sensory diet is a custom-made, individualized plan that we come up with for parents to carry out at home. And this plan can include anywhere from home exercise program with exercises to yoga positionings, suggestions for bedtime routines, calming strategies, alerting strategies for morning routines. It's a variety of things, but what we're looking for is to come up with activities and suggestions that help organize all the sensory input.
Wow. So if a parent has concerns about the sensory issues that we just talked about, what do you recommend they do?
Well, the first thing I recommend is observation, and record your observations. Where do you see the children having difficulties with fine motor? Is it just handwriting? Is it dressing? Secondly, with sensory, again, observations. When are they having difficulty? Gather the observations from the teachers. And then, of course, with any concerns that you have, bring them to your pediatrician. From there, they can give you some idea if OT evaluation is warranted. And, of course, we're always happy to help at Grace Cottage.
Okay, thank you very much. Well, wow, I learned a lot today, and I got to show my fine motor skills. Melinda, thanks for taking the time to be on the show.
Thank you.
We'll be right back with Liz Harrison, a health coach who will teach us that good food in our stomach is fuel for the brain. My mother told me that all the time. But first, this brief message from the American Chiropractic Association about backpack safety.
Along with pens, pencils, and paper, backpacks have practically joined the list of must-haves for children heading off to school. To minimize the back and shoulder pain now experienced by millions of children who use backpacks, the American Chiropractic Association offers parents the following tips. Be sure the backpack is the correct size for your child. The backpack should never be wider or longer than your child's torso and should not hang more than 4 inches below the waistline. A low-hanging backpack increases the weight on the shoulders, causing your child to lean forward when walking. Choose a backpack with shoulder straps that are padded to relieve unnecessary pressure on the neck and shoulder muscles. Choose a backpack with adjustable straps to fit your child's body properly. And as a rule of thumb, children never carry more than 10% of their body weight. Teaching your child to backpack wisely now will help avoid unnecessary back and shoulder pain in the future.
Welcome back to Grace Cottage Hospital's Healthcare Matters, a monthly show that brings timely information about health-related topics. Our guest is Liz Harrison, a health coach, and she's here to talk to us about good nutrition. Welcome, Liz.
Hi, Marty.
So, let's start at the very beginning. How important is breakfast? My mother said it's the most important meal of the day.
It is the most important meal of the day because it breaks the fast of the body doing its janitorial work at night. It also needs to provide vitamins, minerals, enzymes, proteins, essential fats, and complex carbohydrates in order to have the body work properly. This can very easily be done in smoothies and things of that sort. Children especially, as well as adults, are vulnerable to poor ability to learn and behave well without proper nutrients. It's also very important to have a good breakfast because the more healthy calories you have at the beginning of the day that you're going to burn off, you can actually take in the same amount of calories and lose weight instead of eating all of those calories in the evening and sleep on that. So it's a weight loss support, and it's important to eat like a king at breakfast, a prince at lunch, and a pauper at dinner.
Okay, so let me think about that for a second. Okay, well, but in the course of the day,
Right.
We have snacks.
Right.
So, is there such a thing as a healthy snack?
There certainly is, and it's coming from real food. Packaged food and refined starchy foods do not bring with them the nutrients to nourish our body. When you have things like carrots and hummus, celery and peanut butter, those are real pieces of food that Mother Nature put out there. And chewed to the point of mushy, where the nutrients can get into the bloodstream, there's a very healthy snacks, cheese and crackers, but make it real food that Mother Nature has put out there and not what man has packaged in refined starches.
Okay, so I had a really good breakfast.
Yeah.
I've had some healthy snacks.
Right.
And now I'm ready for a healthy lunch.
Yes.
What am I eating for lunch?
Well, if you're the school system, I would suggest probably, depending upon what school, that you bring your lunch. Have a whole grain sandwich with meat and vegetables in it, and a piece of fruit. It really means that a fist size is a serving. And if you're a little child, a fist is going to be smaller than an adult. But if you can get 5 or 6 servings of fruits and vegetables down every day, you're going to be healthier. So lunch can be soups, it can be leftovers from the evening before, it can be finger food for a child, vegetables dipped in their favorite dressing, things like that. So that at least it's real food, if they're learning to select at a steam table at school, put some fruit and vegetables on there before they put the high-fat refined starches of pizza and stuff.
So that's interesting. So, in terms of the school lunches, so I have to be honest, my memory is not as good as it should be. So now the kids go in and they have this choice. So the kids are choosing.
Yeah.
So we have to make sure that they choose the right foods.
Yeah. Well, it also Vermont has done a really good job in many of the schools to help have healthy meals, and I'm very proud of the state in this. In many schools nationwide, that's not the case. When you look at what's going on in a lot of the schools, I just look at the film Fed Up. But having choices that have a fruit, have a vegetable, have a protein, those are the kinds of choices, whether it's a salad or a cooked vegetable, things of that sort.
Wow, okay. Yeah. So now I've had my lunch. I've gone back to class. It ends. I'm going to have another. When I get home, I'm going to have a healthy snack.
That's right.
Okay, because when we are more hummus and carrots and celery.
Yeah.
What about in terms of drinking? I've heard. How much water should I be drinking as an adult versus how much water should a kid drink?
Okay. We take a look at 50% of your body weight for the healthy weight. Now, let's say you should weigh 150 pounds, but you weigh 200 pounds. So we're going to take that 150 pounds and cut that in half and say maybe, 60 to 75 ounces of water. Now, that means a lot of fluids, so your smoothies can take up that. There are a lot of ways to get the water down. Have a glass of water with every meal, have some when you get up in the morning. And when you're active, you're going to be more thirsty. So that, that can make up some of that too. But fluid, healthy, clean water does not include anything that has food colorings, food flavorings, and sugars like that. It's just your clean herbal teas, your healthy juices, things of that sort.
Okay, so you just talked about juices. Now that's if I have an opportunity to give my child water versus 100% orange juice or something, is there a benefit to water over the juice?
When I look at juice, I look at pureed fruit. Pureed fruit has all the vitamins and minerals and enzymes in it to metabolize it. When you take commercial juice, you're taking the sugar water out of the fruit, and that's going to be a natural sugar hit. So you really want a whole piece of fruit. And if I want to make juice at home, I take berries and I puree them and add some water to it. That's how I make a juice. So I've got the whole fruit.
Wow. Okay.
Then you get all your vitamins and minerals.
So you make your own juices. That is something. So all of those commercials that we see for, healthy fruit drinks and things are really not as good for you as good old water.
Water is the healthiest drink you possibly can have.
Wow.
Yes.
Okay. Well, that's
clean water.
all right. Now here's another one for you. Since I was knee-high to a nipper, I remember Flintstones had these. But what about vitamins? Should we be giving our kids vitamins?
Okay. In yesteryear, our parents, our grandparents, had fabulous farms where the soils were not depleted, and they had a higher nutrient content of the food they had on the farm. As we get into the commercially produced food in the nation, we don't have as many nutrients in the food getting from depleted soils. And then a lot of the manufacturing companies have put together packaged foods which don't have the nutrients in them. There's two kinds of foods. Foods that bring with them the vitamins, minerals, and enzymes to nourish your body, and foods that deplete your body, which are the packaged foods and the soils and the foods from depleted soils. So the American Medical Association has clearly said we do need a supplement. Now I would suggest that a parent check with their doctor, look at the kind of food the child is eating, and if the doctor feels their laboratory work and things like that have some needs, or their behavior indicates that they're not sleeping well, they have poor energy, their appetite is off, there's a lot of symptoms of not having the proper nutrients. So it comes from a medical decision of what's right for you, but the Medical Association has said absolutely we should be taking a supplement. Please, if you're going to buy a supplement, make sure it does not have sugar, food colorings, food flavorings, or items in it that you cannot pronounce.
Okay, that leaves me out with a lot of those things. But in terms of a lot of the vitamins are available, over the counter. I go down to to my local drugstore, and they have them specifically geared to kids. But what you're saying is you should talk to your doctor before you give your kids these?
Absolutely, because your doctor knows best what's right for your child. And a lot of the kids' vitamins, the first ingredient is sugar, and that's not one I would buy. But make sure that at home, if a child is eating 5 to 6 fist sizes of fruits and vegetables a day, getting whole grains, getting plenty of protein, getting plenty of fluids, then the child may or may not need, and it depends upon the quality of that food. But the parent and the child with the doctor can determine whether they need supplements.
Wow, when I think about how much money is being spent on those vitamin commercials, that's really eye-opening. All right, last question for me is, if somebody wanted to talk to you, not on TV, but they had a question about their kid's diet or maybe even their oon, how do we do that?
Well, you can call 365-3766, which is my direct line, or email me at eharrison@gracecottage.org. It's a free of charge service with the community health team. There's no cost, it's never built in any insurance, and we'd be happy to talk to you.
Free?
Absolutely free. Absolutely free.
Okay, that number, I bet you're going to get a lot of phone calls after today, Liz. Thank you so much. I would like to thank our guests, Melinda Roy and Liz Harrison. And I'd also like to give a shout out to Roland Boyden for doing all that behind the scenes magic to make this show possible. I also want to thank BCTV for allowing us to bring this show to you. Our next show will discuss women's health screening. Women's health screening, very interesting topic. If you have any questions about anything that you heard today, or if you have any concerns or even ideas for future shows, you can send them to info@gracecottage.org. That's info@gracecottage.org. I'm Marty Cohn. Thanks for watching.